Hey, what's up guys? My name is Brian Casey Venus of grade 9, here to present to you my video presentation of the medical career. Let's begin. So, the medical career is a big and broad category to work in, which mostly consists of diagnosing, treating, and preventing any and all diseases and disorders of the human body, with all jobs in it having huge responsibility and with a lot of effort, but with amazing rewards in the end. The main/biggest levels of the whole medical career are the physicians, the physician assistants, and the medical assistants. In case you're wondering where to sign up as anything under the medical career, you can employ in places such as private practices, clinics, hospitals, public health agencies, research facilities, health maintenance organizations, aka HMOs, government agencies, or colleges and universities. And for the record, good luck with that. The physician, aka doctors, is a huge and hard-working job/career for those who are extremely not lazy and in desperate need for more education. These people do a lot of great but effort-consuming duties such as examine patients for problems, obtain medical histories or records, order tests, make diagnosis, perform surgery, treat diseases and disorders, and even teach preventive health to others, and a lot more. The physician alone is also vast, which includes the doctor of medicine. They're the kind of people who diagnose, treats, and prevents diseases and disorders, but also specialize in the fields of anesthesiology, cardiology, dermatology, ophthalmology, and a lot more. The doctor of osteopathic medicine, they're the kind of doctors who treat diseases and disorders, but also placing special emphasis on the nervous, muscular, and skeletal system. They also emphasize in treating the body, the mind, and the emotions. The doctor of podiatric medicine, their job is examining, diagnosing, and treating diseases and disorders of the feet or leg area below the knee. The doctor of the chiropractic, they're the kind of doctors who focuses on ensuring the proper alignment of the spine and optimal operation of the muscular and nervous system to maintain good health. The physician has a career with an above average growth to year 2020 and with an average yearly earnings of around 141K to a whopping 459K. Wait, what? Wait. What? Holy cow, that's a lot of numbers! I could say this is rewarding. Anyways, the educational level required here is huge and effort-taking. Well, of course, how else can you ever get 459K without any effort, time, or education at all? That's a no-brainer. No pun intended. As I was saying, the educational level here is that you need a doctorate degree or 3 to 8 years of additional postgraduate training of internship and residency, depending on the specialty selected, a state licensure, and a board certification of specialty area. The physician assistants work under the supervision of and do jobs as assistant physicians as the name implies, doing things like take medical histories, perform routine physical examinations, basic diagnostic tests, make preliminary diagnosis, treat minor injuries, prescribe and administer physical treatments, and for pathology assistants, they do gross and microscopic autopsy examinations. Wow, that's a mouthful of duties. Anyways, as I was saying, the physician assistants have an above average growth to year 2020 and with an average yearly earnings of around 70K to a decent 129K. The educational level here is that you need 2 or more years of college or accredited physician assistant programs and usually a bachelor's or master's degree. A licensure in all states is a must and is required to do so, and it also needs a certification from the National Commission on Certification of Physician's Assistants. And lastly, the medical assistants, just like the physician assistants, they also work under the supervision of the physicians, and they also do basic assistant duties like prepare patients for examination, take vital signs and medical histories, assist in procedures and treatments, and prepare and maintain equipment, all that stuff. But the difference between a medical assistant and a physician assistant is because of the type of facility that is worked in, and the physician that works under determines the kinds of duties. And the range of duties is also determined by the state law. Okay? Okay. The medical assistants also have an above average growth to year 2020 and with an average yearly earnings of around 26K to 48K. The educational level here is that you need 1 to 2 years of HSC programs or an associate's degree. It can also need a certification from the American Association of Medical Assistants after graduating from accredited medical assistance programs. It can also need registered credentials from the American Medical Technologists, or it can even need certification from the Clinical Medical Assistants from the National Health Career Association. And that was all the jobs and careers inside the medical career. I hope this educated you in a way, if you even pay attention though. I mean, my voice in this presentation, it sounds a lot boring. It's just my opinion, I don't know. And also for it to give you consideration of what job you're gonna get for the coming future. And for that, good luck in the future. And this is Brian Casey Abinas signing off. Thank you.